In Muscatine, Iowa, one clinic's 15% growth reveals a huge American healthcare shift. This shift involves a choice that could save you over $1,500 on a single doctor visit. On a national level, that same choice saves the entire healthcare system billions each year. It's why the number of urgent care centers in America has nearly doubled in just one decade. So, what's behind this massive change? We'll show you the forces, from doctor wait times to new generational habits. The problem starts with something familiar: getting an appointment with your primary care doctor. The average wait for a new patient is now 31 days. When your child is sick or you sprain an ankle, a month-long wait is not an option. Urgent care offers the instant fix. Walk-in service with waits often under an hour. But is the quality of care the same? The data says yes. Their medical staff have the same professional training as those in hospitals or private practices. It's not for severe emergencies, but for the huge middle ground of colds, infections, and minor injuries. Think of it as the bridge between your family doctor and the ER. Many are also one-stop facilities. With on-site X-rays and labs, they can diagnose and treat you in a single visit, saving you multiple trips. So we have a model that's faster, equally qualified, and more efficient. But what actually triggered this enormous expansion? A primary driver is in your wallet: the growth of high-deductible health plans. These plans make you pay more upfront, so the price gap is decisive. Financial pressure is a strong motivator, but a fundamental behavioral change is also happening. Why are younger generations moving away from the family doctor model? Millennials and Gen Z expect on-demand service and are less likely to form a bond with a single physician. They frequently use urgent care as their main entry point. The answer is simple: urgent care matches their consumer habits. It's transactional, convenient, and technologically integrated, like other services they use. These drivers, access problems, money pressure, and generational habits, created a usage surge. Total spending on urgent care jumped over 50% in just 4 years. We see why people are making this choice. Now let's examine the staggering real-world effects this shift is having on the whole system. First, easing the load on emergency rooms. Annually, urgent care centers prevent an estimated 24.5 million ER visits. Second, unmatched convenience. Over 78% of the U.S. population now lives within a 10-minute drive of a clinic. Third, filling critical needs. They are especially vital in rural markets and areas that are facing physician shortages. And the biggest effect: billions in savings. By redirecting non-emergency cases, they save the healthcare system $3.3 billion every year. The advantages are clear and significant. But is urgent care a perfect replacement for a traditional doctor? It's more complicated. The primary drawback is the absence of a long-term patient-doctor relationship. It's great for immediate problems, but a PCP is needed for chronic health. And those high-deductible plans that send patients to urgent care? While they promote cost awareness, they can sometimes cause people to postpone needed care. The industry is aware of these issues. This is why we're seeing the development of hybrid models that add primary care services into the urgent care clinic. The line is blurring even more with new technology. Advanced tools like AI scribes and real-time scheduling are making the entire experience smoother. So we have the problem, the solution, the drivers, and the nuances. How does this all connect back to what's happening in a town like Muscatine? Let's connect the pieces. We began with the 31-day wait to see a physician. Combine that with a generation that wants on-demand service, and it becomes a necessity. Next, add the financial strain from high-deductible insurance. This redirects patients from overcrowded, expensive ERs straight to a more affordable option. The conclusion is undeniable. Urgent care is no longer a temporary fix. It has become a structural support for the American healthcare system. Which leads us back to where we began. Clinic expansion isn't just a statistic. It's the local evidence of these massive national forces coming together in one place. It shows a community looking for faster access, insisting on better value, and adjusting to a new healthcare delivery reality. The growth of urgent care clinics is a direct response to patient needs, care that is available, affordable, and on their schedule. A more responsive system. The next time you see an urgent care clinic, you're not just seeing a doctor's office, you're seeing community medicine evolve.